Hello everyone, welcome to Dentition. We are back with our lectures in social sciences, and as I already said in my last lecture that we are going to continue. Our next lecture will be on accommodation reflex and errors. So here we are. Just a reminder, you can ask your doubts in the comment section, and we also provided the PDFs of these slides. So without wasting much time, let us begin. Firstly, what is accommodation? Accommodation simply means the adjustment of the eye to see either near or distant object. It is a process by which the light rays from near object or distant objects are brought to foci or the focus on a sensitive part of the retina. We all know, right? In class 10, we already read what is foci, what is retina, what is foci, and how the image is formed. Correct? These are the ray diagrams which you must have a clear knowledge about. Next is the pathway for accommodation reflex. From eye, it moves to the optic nerve, optic chiasma, optic tract. This you have to learn, or you have to learn it by seeing the diagram which is given in your book. Okay? There's nothing to make you understand in this. However, I have shown you the chart. You can add this in your diagram in your answers if it is being asked in your question book. Next, the errors of refraction. This is the most important topic of this unit, where you can ask short note on myopia, hypermetropia, or astigmatism, like that. So we are going to discuss here regarding myopia and hypermetropia. Firstly, what is ametropia? The eye with normal refractive power is called emmetropic eye, and the condition is called emmetropia. Okay? Any deviation in the refractive power from normal conditions resulting in inadequate focusing on the retina called ametropia, and the eye is called ametropic eye. Hope so this is clear. The defects are of two types, namely myopia and hypermetropia. Please note, you can also be asked the differences between them, which I will mention in the importance of physiology. I've already mentioned, or I will mention in the third part, the importance of physiology that we are continuing. In part 1, I have mentioned some units. In part 2, I have mentioned some units. And in part 3 that I will make, I will definitely mention these topics again so that there will be a revision and there's a reminder for you. Next, moving ahead, we have discussion on myopia. What is myopia? It is an eye defect characterized by the inability to see a distant object. Means the near object is very much clear to you, but while seeing a distant object, you will face difficulty. That is the inability to view the distant object. It is otherwise called short-sightedness because the person can see near object clearly but not the distant object. Clear? In myopia, the near vision is normal but far point is not infinite. That is, it is at a definite distance. In extreme condition, it may be only a few centimeters away from the eye. So what are the causes and how will you treat it? How will you correct it? Causes include the refractive power of the lens usually is normal, but the anteroposterior diameter of the eyeball, yes, the anteroposterior diameter is abnormally long. Okay, therefore the image is brought to focus a little in front of the retina, but not on the retina. Okay, so if it is not on the retina, the image that is formed will be a blurred image, and you will not be able to see the image of the distant object. So how will you correct it? You definitely have to change the lens. So what we will do, in myopic eye, in order to form a clear image, light rays entering the eye must be divergent and not parallel, obviously. Thus, the myopic eye is corrected by using biconcave lens. Please note it, biconcave lens is used to correct the myopic patients. Light rays are diverged by the concave lens before entering the eye. Clear? That is why biconcave lens is also known as diverging lens. Moving to hypermetropia or hypermyopia, it is a condition in which there will be an inability to see the near objects. It is otherwise known as long-sightedness because the person can see distant objects clearly but not the near objects. It is also called hyperopia, hypermyopia, or hypermetropia. In this defect, the distant object is normal but the near object is affected. Clear? So two major differences are in front of you. That is, the how will you correct myopia and hypermetropia, and what are the causes and what happens in myopia and hypermetropia. So what is the cause? Here the anterior posterior diameter decreased. So even though the refractive power remains normal, light rays are not converged enough to form a clear image on the retina. It causes a blurred image as it formed in myopia. So how will you correct it? You will correct it by using biconvex lens. This time it's biconvex lens, last time it was biconcave lens. Light rays are converged by convex lens before entering the eye. So biconvex lens, we all know that it is also known as converging lens, helps to converge the light rays formed from the near object and cause a clear image of that object in the retina. Okay. Next, we have presbyopia. What is presbyopia? It is very rarely asked, but you may ask in your Viva or in your 2 marks questions. What is presbyopia? It is a condition characterized by progressive diminution of the ability of eyes to focus on any near object with age. That means it is similar to myopia, but it occurs due to aging. It is due to the gradual reduction in the amplitude of the accommodation. What is accommodation? Again, let us give you a reminder. The movement of the eye to view in a near or distant object is called accommodation. It progresses as the age advances. Presbyopia starts developing after middle age. In presbyopia, the distant object is unaffected. Only a near object or the near point is affected and is away from the eye. In presbyopia, what it happens? The anterior curvature of the lens does not increase during near vision. So, what? The light rays from near object are not brought to foci on the retina. Clear? If you understand myopia and hypermetropia properly, you will definitely understand presbyopia. Basically, it occurs due to aging. Next, what are the causes? Decreased elasticity of the lens is because of the physical changes in the lens and its capsule during old age. So the anterior curvature is not increased during the near vision. How will you correct it? You will correct it by using biconvex lens. Okay, let me ask you, where do we use biconvex lens? In myopia or hypermetropia? Yes, definitely. We will use it in hypermetropia. Why? It is a convergence lens and we know that for hypermetropia correction, we need a convergence lens. Correct? So you can relate presbyopia with hypermetropia. But yeah, definitely you must keep in mind that presbyopia occurs due to aging. Thank you. That's it for today. We end our today's lecture here. Keep learning and keep supporting our channel Dentistry. We'll continue with special senses. Till then, keep learning. Thank you.